You're watching this video today because you have some questions about what in the world is visual training. That's a good question. Visual training is done by a very small percent of doctors, okay? I would say visual training is done by maybe 10% of my profession, right? Now, what is very interesting about it, that 10% of us, we all have different methods of doing visual training. But let's start over, like, what is visual training though, okay? What visual training is changing the way you use your eyes. Now, the challenge in our country is that our profession I don't think is communicated correctly. Would you believe that the American Optometric Association, about 20 years ago, had a turkey explaining eyesight stuff? A turkey! Like we're turkeys, okay? Now, if that doesn't let you know what's going on with my profession, I'm sorry to say. So I don't think I'm a turkey. I don't think the rest of my doctors are turkeys either, okay? But most of us are caught up in this thing called eyesight. There's a difference between eyesight and a difference between vision. Eyesight is just simply seeing something clearly. Can I see the picture on the wall? Yeah, very valuable. It's great. You can enjoy beauty. But understanding what you see is what vision is all about. That's how it's related to learning in school. But there's more of it than that. Your eyes don't stay still. You're not just looking like this all day. You're moving your eyes around, especially if you're playing sports, right? And so you've got to move your eyes from place to place. That's a part of vision. And how about a student in school? What do they got to do? You got to take your eyes, you got to move them in here. I got to look at the book, and then I got to look up at the whiteboard. I got to look at the book. And I got to look at Johnny, what he's doing over here, because he might throw a spitball at me, right? Okay, so you got to have eyes to do that. What else have you got to do? You have to concentrate, you have to sustain. You have to keep looking at the book. And then Susie's over here, curling her hair, and you're thinking, gee, look how long her hair is. I mean, maybe you got a vision problem. Okay, maybe that's what's distracting you. So there's a lot more to it. How do I move my eyes? Can I move them close? Can I move them far? Can I see clearly when I look up close? What's really interesting, a lot of doctors assume kids that are 13 and 12 and 10 can focus their eyes up close because that's what the textbook says. You would be surprised how many of them have trouble with that. And yes, we have to teach that. So what we do is we teach people how to better use their eyes. It's obvious, a crossed eye, that something needs to be done there. The eye's turning in and looking at the nose. Now, a lot of people think that is an eye muscle problem. That's kind of interesting. A guy named Lancaster in the 1930s actually did a study, and he found out the eye muscles are anywhere between 50 to 100 times stronger than they need to be. So we're not looking at an eye muscle problem, we're looking at a coordination problem. Can we teach coordination? Why is it looking in at the eye? Why is it looking at the nose? Excuse me. There's a reason. The eye doesn't, hey, I'm having trouble getting these two guys to work together, so I'm going to look at my nose so the other one can see the real object instead of seeing double. Some people let their eyes turn out. We can help them straighten them out. We teach people how to straighten their eyes in a non-surgical way. When you compare surgery to vision training, as an example, those who turn their eyes out, the cure rate is 85%. Those who turn their eyes in, the cure rate is around 67, 69%. Okay? However, the only studies that have been done in surgery shows the success rate of surgery is in the teens. And what is the effect of surgery? What can happen? You can literally die, because when you cut a certain eye muscle, it stops the heartbeat. And you want that heartbeat to start up. And in some children, that heartbeat did not start up, and that has caused death. Now, doing vision therapy, you can't cause death, okay? And we get better results from surgery. But how about school classroom learning? We all know we use our visual system. The lowest estimate is 80% of learning is through the visual system. And I think that's a very low estimate, but that's good enough for me, okay? Now, can you imagine then, hey, maybe vision's got something to do with Johnny's vision problem. But where does that vision problem come? Well, has it got anything to do with seeing the chalkboard across the room, this 20/20 number? Well, back in the 30s again, the Dartmouth study, what they did, they found out that the kids with the worst visual acuity were the best students. Of course, they're the ones that are reading. They're nearsighted. And you know, you would think our profession would look at that and say, why are we taking visual acuity screening in the schools to find out if this vision is related to learning? Because we know it's not. So if your child, and they're still doing it even after that study. To this day, all they do is have a kid look across the room and see if he can see clearly. Now, Berkeley College of Optometry decided to add a few more things, but all that did is made it easy for the doctors to prescribe glasses for you. It has nothing to do with learning in school, even though Berkeley's modification of that, it didn't help. All right? So, we've got to look deeper. We have to look at vision processing skills. When I get the information, when I see it out there, when I bring it in, what can I do about it? Can I concentrate on it? Or do I get distracted when I look all over the place? Can I remember what I saw? Can I visualize something when I'm reading my book? Can I tell what that story is? Can I repeat the story back to you? Can I actually see it in my mind's eye? These areas here all can be changed. So when you're doing visual training, you're coming actually into the office. And when you're in the office here, we're working, and what we do is we put your eyes in a situation where the only way you can succeed at some of these fun procedures that we do is to get your eyes to work together as a team. Or so that you can visualize correctly to do the activity. Or can I concentrate enough to do the activity? Can I move my eyes enough to do the activity? And we slowly start at the level upon which you can work and enhance it and enhance it and enhance it. So yes, visual training did start with crossed eyes. And then as they were working with crossed eyes, they found out, you know what? When Johnny got his eyes straight and all that, all of a sudden Johnny started doing better in school. So they thought, well, wait a minute, then visual training has to be related to learning in school. So once they got doing that, they found out that Johnny, now that he did better in school, he started improving in athletics. So what did we do next? We put visual training into athletics. And my mentor is Bob Pepper, who worked with the Portland Trail Blazers and built that basketball team into a real powerhouse. And it's neat to see those things and to work with people that are athletes and work with them there to enhance the vision. Larry Fitzgerald is a good example of a professional athlete. He's a wide receiver for the Arizona Cardinals. His grandfather is an optometrist who does visual training just like I do. And his grandfather worked with Larry because he originally liked that sequence. He had trouble learning in school. When they started changing the learning in school, he started doing better in athletics, so they added the athletic part to it. And the reason he's such a good wide receiver today, they say it's because of his hands, but remember, what is it called? Is it hand-eye coordination or eye-hand? It's eye-hand coordination. His good eyes is what makes him a good wide receiver for the Arizona Cardinals. And there are many professional athletes that have had care by optometry. Myself, I've worked with some racing car drivers and with an Olympic swimmer. And you don't have to be a professional, you can be a golfer, and we changed the golf score, the golf handicap of one patient by 6 points. Boy, was he ecstatic, okay? Then what we found out is that people are doing better in athletics. They found out, hey, my work is easier to do. I'm not working so hard in the job. And so now what we're doing is working and enhancing people's ability to do their job. One of our patients named Dr. Savinsky, a successful chiropractor, came to me because he was exhausted at the end of the day, even though he was doing well. And he had a tendency for the eyes to want to turn out. We worked with him. When we finished with him, all of a sudden, well, what he was saying at the end, he didn't have time to read. It hurt him too much. It bugged him too much, even though he's smart and did a good job in college. All right? So when we completed, he became a voracious reader and then expanded his practice even more. And he's now sold his practice, goes throughout the country, teaching other chiropractors how to perform well. What does he tell each one of the people that he's working with? Find somebody who does what Dr. Henshaw does to enhance your ability to do your job as a chiropractor. So you can see there's a wide range of activities upon which vision therapy can help. Okay? But what it basically is doing is kind of simple, making you efficient and effective in how you use your eyes.